Welcome to the Emory PA virtual open house, and we've recorded this because of the COVID epidemic and we're practicing social distancing. So I'm speaking to you from Emory South, which is my condo living room. So I'm going to give you a little bit about the Emory PA program and requirements and on with the show. First of all, a little bit about my background, then we'll go into PA life. The Emory PA program, especially the requirements as an applicant, and then the curriculum, what the PA program entails, and then we'll have an area, a QR code for submitting questions that we will answer for you. So if you could hold questions till the end and submit on the Google form that we'll make available to you. First of all, my background, I am a PA. I have graduated from the Emory PA program in 1979. I started in 1977 after graduating from Georgia Tech as an engineer and changed my direction into clinical care, and this seemed to be the best fit for me because I was not pre-medical. And after graduating from the Emory PA program, I started work at Grady, where I spent 25 years in clinical practice. 20 of those years were running a sickle cell unit 24/7 for the sickle cell population in North Georgia. And I got to be involved in research, publications, being an administrator, but also a clinician. And so could take on several roles that made it very interesting. I got involved in education by precepting PA students, having them rotate for a month with me at Grady, then started giving lectures, then took on a class, and eventually I decided to move over into the academic realm to teach the next generation. So I am a teacher in the program. I teach all the way from the beginning, an orientation, and moving all the way to the end with a board review course. So that's my background. I am married. My wife is a physician, went to Emory Medical School and practiced here in Atlanta for several years and ended up at the VA Medical Center. I have a daughter that is a PA, and I also have another daughter who works in the federal court system. So on with the show. Let's talk a little bit about PA life. First of all, these are the 3 ways to take care of patients and make diagnosis and treatment. First of all, should be well known to you is the MD-DO route. Again, primary care physicians, the average salary is $223,000 a year. That's a good salary. It requires 4 years of undergrad, 4 years of medical school, and 3 to 4 years of residency training, even more if there's a fellowship involved. So it could be up to 12 to 15 years. Over 10,000 hours of clinical experience during that training time. And so usually the physicians are locked into a specialty. Once they pick a residency, they have to stay in that field. Otherwise, they have to go back through a residency to change and be reboarded. The next step is a nurse practitioner. You can do that through becoming a nurse first. You have to be a registered nurse, usually a bachelor's degree. 4-year nursing school, and then 2 years at an NP program for 6 years total. These are specialty based, so you have to pick your specialty to decide which program to go to. There's usually only 720 hours of clinical training in these programs. It's several hours less than a PA program. This is a master's degree, moving to a clinical doctorate for most programs, and there are 350 nurse practitioner programs. You do have to go back into another program if you want to change specialties, and you can see the average annual salary. PA, again, you can come from any undergraduate degree, just get the prerequisites for the program. Most PA programs are between 2 and 2.5 years. Emory is 29 months, and we'll explain that in our curriculum. It's 2,000 hours of clinical training. That's a whole year doing clinical rotations. So that is much higher than the nurse practitioner programs. It is a master's degree, and that is pretty much the standard across all PA programs now, and according to our AAPA. There are 250 programs and more on the board to come up. so you have lots of choice. We do have board exams, and we're licensed under the medical board, same as physicians. But you can migrate specialties. You don't have to go back to school. You just change your physician, your sponsoring physician with the medical board, and they train you basically on the job, so you can migrate from specialty to specialty. So again, you should be in clinical care somewhere to talk to physicians, nurses, and PAs and decide, are they happy? So that's why we value experience and getting behind the doors and talking to different practitioners. Study done basically by the Mayo Clinic found that the burnout rate in physicians now is about 54%. Again, a lot of administrative burden and trouble with electronic medical records, basically spending lots of time with the documentation and paperwork and administration. On the converse side, again, PAs are generally happy. They can have a high degree of job satisfaction, autonomy, good income, patient responsibility, and backup support, as well as career advancement. So that is a difference that we see and why people are choosing to go the PA route. Again, it's the best, number 3 on the best jobs in America by U.S. News and World Report in 2019. And it's number 1 healthcare job. So of all the healthcare professions, PA is now number 1. Again, what do you do as a PA? Everything your physician does: the history, the physical exam, order, interpret studies, you assess and diagnose. You perform procedures based under the basically the license of your physician and what they do, their scope of practice. You can prescribe in all states, and like I said, you basically function independently, but with dependence on having backup and having working with a mentor. You can be migratory. You can change specialties without retraining or reboarding. The only exception to this is anesthesia. There is an anesthesia assistant program that Emory has one, and there's a handful around the country, but it limits you to certain states of practice, and you can't migrate out of that specialty. There are other opportunities for PAs, including research, administration, public health, education, and leadership, and for several different areas. Wherever there are physicians, there are PAs stepping into roles, the same roles. So there are areas for you to migrate to, even not in clinical practice. Again, will you have a job? 31% growth is projected by the U.S. Bureau of Labor and Statistics. Again, that is, I think everybody will be employed if they want to be, and the job market is expected to exponentially grow. Again, where do you practice? It could be hospitals, urgent care centers, schools, universities, outpatient or inpatient. You get to pick the area that you feel the most comfort in or what is near you. And it's in every specialty. The only one being an exception is anesthesia. So again, primary care, the surgical subspecialties, the medical subspecialties, pediatrics, emergency medicine, and others. Critical care is a big one. So if you're going to be a PA, where do you want to get trained? Well, U.S. News and Report has rankings, and Duke is always number 1. They are the beginning of the PA program. It was the first program to be established in the United States, followed by Iowa, then Baylor, Utah, and Emory. Emory is number 5 on the hit parade. And I think that's the quality that you're looking for. Again, you can learn about us by, again, our website, or, and again, you can read all about the qualifications and requirements. Everything has been updated and available for you on the web. We even have an Emory PA magazine you can download and read stories about some of our PAs doing global work. And again, where's our history? We started with Dr. J. Willis Hurst at Grady Hospital. He was a cardiologist. He was good friends with Dr. Stead, who founded the program at Duke. Turns out that Dr. Stead grew up in Decatur and went to Emory undergraduate, Emory Medical School, did his residency in the Northeast, but then came back to Emory as chairman of the Department of Medicine. And this is him on the front steps of Grady Hospital. back in 1942. He actually took the medical school down from 4 years to 3 years to get the physicians out quicker during World War II. And that sounds a lot like a PA training. And then he went to Duke, and Duke is number one, founded by Dr. Stead, but Dr. Hurst was his friend and really got wind of the idea and started training corpsmen at Grady in cardiology. It moved to a degree granting program at Emory in 1971, and then a master's degree in 1988. So we're not the oldest program, but we're in the core of the beginning programs in the US. So what is our mission? Every school has a mission. It's good to know that before you apply and make sure it is compatible with your philosophy. The Emory program is seeking to mentor a diverse group of students, and we do value diversity. And we want to train you to be the best, to be compassionate healthcare providers of the highest quality. So our job is to get you ready to excel as a physician assistant in the medical community. These are our goals, again, to support you along the way. I think we're a very supportive school. Our diverse class is very supportive. We don't want competition in the classroom. It's competitive to get into Emory, but once you're there, we want all 54 to graduate. So help each other to get through this. We teach you using evidence-based medicine, and again, we have a lot of different ways to teach you using simulation, real patients, and like I say, that is all available to you to give you a quality education. We want to recruit and mentor a diverse student body, and I think you can see in our statistics that we do strive to do that, and we bring people in from all over the country, even different countries, of all different backgrounds. And we want to have our students engaged in the community, giving back to underserved populations. So as a student applying, we really like to see that you're involved in underserved populations, that you're serving as a volunteer, that you're reaching out to those that are in need. We have our Farmworker project and our Good Samaritan clinic, and several health fairs around Atlanta that our students are involved in while they're here. And we really value that as an applicant. So what is the requirements for Emory? Again, you have to have a bachelor's degree from an accredited institution, and that can be in anything as long as you have the prerequisites. There is no one perfect undergraduate degree. We've had business majors, nuclear engineers, we've had people from biology, chemistry, business, even we've had people who've graduated as music majors. But as long as they kept the prerequisites and have a heart for clinical care and medicine, you can do well. You have to have a GPA of 3.0 total and in all your science courses computed by CASPA. If it's below that, your application will not go further. So you got to get that GPA up to at least 3.0 and both total and science. You have to have GREs within the last 5 years. We're not going to change that. There is another test out there, but we are not going to use that right now. We're sticking with GREs. You have to do the CASPA application and a supplemental for Emory. Most PA programs do have a supplemental where they want to know specifically why are you choosing us and want specific information important to them. So there is a fee associated with that. Applicants must meet all of our technical standards, and you must have 2,000 hours of direct patient care. And that's one of the highest of all PA programs. Again, we value you getting behind the door with patients, taking care of them either as a medical assistant, a scribe, any other way. We have athletic trainers, med techs, we have EMTs, but we have a whole variety of ways to get clinical experience. That is about a year worth of experience for 2,000 hours. So please do not submit your application to CASPA if you're submitting to Emory if you're under 2,000 hours, because your application will not go further. Those are the two non-negotiable criteria that we use. For prerequisite courses, statistics, just 3 semester credits. The natural sciences, we need biology with lab for 4 semesters, general chemistry with lab for 8 semesters, organic or biochemistry, not survey courses, for 3 semesters, and then anatomy and physiology for 8 semester hours. So those are all our prerequisites. And like I said, you can have a graduate with any other degree as long as you have these coursework done within a 5-year period of applying. Just to give you a snapshot of the class we just admitted, we had 2,000 applicants on CASPA that had picked Emory. Only 884 had completed their total application. Out of those, we chose 157 to interview over 13 days. We had 4 dual degree students. Now, we do offer a dual degree option for an MPH, a PA degree. It takes an extra year of going to Rollins School of Public Health and then coming to the PA program for the 29-month completion, and you graduate with 2 master's degrees. So we have 4 that are in Rollins now coming to the PA training for a total of 54. And you can see the class here on orientation week. So it's a very diverse group from all over the USA. Again, giving you the statistics of who got admitted, and also this is a good snapshot of who gets interviewed. You can see our number of students accepted into the class is 54. That's the total seats. You can see male versus female, and this is pretty much the way PA training is across the USA. Our diversity, this is underrepresented minorities, is 39%, up over 30% from the last year. Advanced degrees at 22%. These are candidates with master's degrees or doctorate degrees coming to be PAs. Our 4 dual degree students, and usually that's average per class, and 4% veterans. We do value veterans in our class and do support them. The average age went from 27 down to 26-ish. So again, that's a little bit higher than most programs. Again, it shows that people have been working a couple of years before applying, but somebody from 22 all the way to a range of 41. So if you plan it through college, you can be ready to apply right after graduation. You can see our GPA averages is 3.67, 3.69 in science. Our healthcare experience, even though the minimum is 2,000 hours, somebody was interviewed with 2,020 all the way up to somebody with 20,600. The average is 5,000 hours, which is the equivalent of 2.5 years of clinical work. Humanitarian and volunteer service, over 1,000 hours. So whatever you do as a volunteer, please log those hours in CASPA. Tell us what you did, but these are very valuable in our scoring system. You can see the average GRE scores, and again, these don't figure a high percentage of our calculation, but we have them there nonetheless. You can see our geography of our students, mainly from Georgia, because we are in Atlanta. Florida and California are our next biggest states, but then you see a very diverse group coming all the way across the land, including China and Japan. So we all are open to foreign students. But again, the class is very diverse from all different backgrounds and areas from the US of A. You can see our these are the clinical hours logged in, and number 1 is medical assistant, followed by athletic trainers, patient care technicians, certified nursing assistants, EMTs, scribes, emergency department techs, and a whole host of everybody else. So it's a good blend of diverse backgrounds to help each other get through the PA program. Again, anything along these lines where you get exposure to patients and taking care of them. So if you're a bench researcher, that wouldn't count. But if you're a clinical researcher with patient involvement, doing blood pressures, EKGs, interviews, that does count. Pharmacy tech would not count because it's usually behind the counter. But again, these are the ones that I think we find most common in our applicant pool. We are a holistic interviewer, so we look at a 360, including your grades and background and what did you do, your healthcare experience, your narratives, because we read those and score those, your letters of recommendation, your mission fit, that's what did you do as a volunteer, do you serve the underserved. The last thing is the interview day, and that is basically the last point selection for the whole who gets an offer. Our letters of recommendation are best served from people who know you, like patients you've worked with. I mean, not patients, but supervisors, physicians, PAs, other healthcare providers that know you from working in the clinical setting, including your professors in school if they do know you and have spent time with you. So why Emory? Here's why Emory is a good choice. Again, we do have full dissection anatomy offered, and not all PA programs do that. For the fall semester, you're on a team of 6, divided into partners of 2, and every 3rd week you are actually dissecting the cadaver. So it is a lot of time in the anatomy lab, but you are responsible for what your team is dissecting for each body cavity and each part. And you're tested across everybody's dissection. So that's fall. It takes up most of your time in that fall semester, but our students have told us it is such a valuable learning experience. We do have several outside activities, including skills labs, seeing real patients. We do a lot of simulation, and we do small group learning. So that is included with our regular classroom time together too. The OSCE suites are available to us. That's where we have simulated patients. These are actors who will come in with a history and physical findings for you to help make diagnoses that that is all structured and everybody gets the same kind of experience. This is practice for real life, and all these are recorded by video. You can come back and watch them. Sometimes you're as a group, a team, or you're individual. You actually construct a medical record on a computer, and all that is graded and feedback comes back to you. You're actually going out and seeing real patients all throughout the didactic year, and depending on which module you're in, you'll go do patient workups, and we will grade those and give you feedback. We have really developed our point of care ultrasound training for every module. We have 5 handheld butterfly probes that actually connect to iPads, but we also use the $20,000 machines to train you, and we have the smaller, I'd say $2,000 butterflies that you can actually check out and take home and practice. So we got several of them, so we could give you more time to learn normal for ultrasound. Again, this is a brand new field that is exploding, and PAs need to learn this. Again, our faculty, I'd say, is one of the best and experienced in the nation. So we are there to serve you and support you through PA training. We have fun in teaching, and we like getting involved with our students and supporting them. You have several places to learn, and especially clinical year, including Grady Hospital, our inner city 800-bed indigent care safety net hospital with a level 1 trauma center, burn unit, sickle cell unit, several areas of excellence, an infectious disease center that is one of the best in the country. The VA Medical Center is right across our campus, and a 500-bed inpatient, outpatient serving our veterans. We have Emory, Maine on the main campus that is both a specialty service and a general medical for adults. We have the children's hospitals, what is called CHOA, or Children's Healthcare of Atlanta, but Eggleston and the 2 others in Atlanta where you can do your pediatric rotations. And then we have Emory Midtown in the heart of Atlanta, just across from Georgia Tech, big outpatient clinics, inpatient clinics, and all specialties served. These are just a few of Emory's outreach into the community, and there's several other facilities that you can do rotations as long as Emory students have gone before you and we have agreements. We asked our students, why did they pick Emory? And again, it wasn't the tuition. We're sorry about that. It is a private institution. We're not the cheapest, but we're not the most expensive, but we're tuition based. We did no state subsidies for in-state students. So it's the same tuition whether you're in-state or out of state. So again, Emory is a private institution, so we apologize for that. But we do have a good student support system. I'd say our students do feel supported, and we try and make sure that they're going to succeed. We want all 54 we admit to walk across as graduates, and we'll do our best to get you there. They like our admission process. I think it's it's a pretty easy onboarding, and we try and make sure you have all the information you get all the way up to orientation to succeed as a student. Our reputation being a part of Emory is huge, and I think it does open doors for your future. Our Farmworker project is a big reason people chose us as a community service, sort of like a mission trip, but within the confines of Georgia, and giving back to the community. So these are the main reasons I think our students gave us feedback of why they picked Emory. Again, our curriculum, what are you getting in for PA program? What are you headed for? The first fall, right after a week of orientation, you're starting with anatomy with the cadaver lab. And like I said, that is probably the most time intensive of the fall classes. You get in-class teaching, but then you're headed straight to the lab where you actually do the dissections and have lab teachers right there beside you to help guide you. Then you have the introduction to physical assessment. You learn the whole head to toe physical exam in fall semester. And you practice with each other, learning every body system. The final test is a head to toe physical with a proctor faculty watching. The Foundations of Medical Science is a course right before we start modules that gives you the background of pharmacology, genetics, medical micro, and ultrasound, because all these are going to thread through the whole curricula from this point onward. So these are the basics. There's an ethics course, because PAs are ethical, and then a Becoming a Physician Assistant course goes all the way through the whole first year curriculum from BPA 1, 2, 3, and 4. BPA 1 being all about the medical history. And again, very important part of the diagnosis for the patient. You have to know what questions to ask and how to guide the interview. Following first semester in fall, you get a little Christmas break, 2 weeks, and you're right back in January to start the spring module. And there we start going by body systems: psychiatry, dermatology, hematology, GI, ENT, pulmonary, and cardiovascular. During that time, and again, these are 2-week modules, 3-week modules, and sometimes 5-week, depending on the complexity. Each one of these is to kind of focus on that body specialty, because this is how PAs practice. During that spring semester, BPA 2 is going to be all about there's a whole human sexuality course and a determinants of social determinants of health module put together. It's more of a seminar series. And then an epidemiology course, how to read the medical literature and make sure these studies are good, taught by one of our PhDs in epi, who's also the assistant director for the PA program. Again, in summer, you move on through GU, endocrine, orthopedics, and rheumatology. BPA 3 is about the business side of medicine, and it covers getting your job, reading contracts, billing and coding, how insurance works or doesn't work. More about the medical system and your colleagues, the other people you'll be interacting with, such as physical therapists and dietitians and nurses, and all these people on the team and what their role is and how you should work together as a team. In the fall, right before you start clinical, you end up with emergency medicine, surgery, OBGYN, and geriatrics, pediatrics. BPA 4 continues with more of the healthcare systems that you're going to be entering in. There is a summative test at the end of first year where it's called the PACRAT. It's very much like a pre-PANTS exam, which you're going to get right after you graduate PA school. And it kind of gives you a check of where you should be in relation to all the other PA students around the nation at this level. There's some skills testing to make sure you're ready to go out into clinical. And then the fun starts. Starting November, you're out on rotations. Right, each module that we just introduced you to has all the elements that we've listed here, including a review of anatomy, biochemistry, genetics, immunology, microbiology, nutrition, pathophys, physiology, and preventive medicine. There's also a ongoing pharmacology through each of these, talking about the drugs for that module and that body system. You also learn the social determinants of health. You're learning ultrasound for that body part, that body system, and then you're seeing structured patients out in the community hospitals where you do workups that are graded and feedback is given back to you. So you learn how to present, do a history and physical, and how to write that up. And meanwhile, you're in the simulation lab learning procedures, and we're having OSCEs where the actor patients are coming in for that particular module. So we do have small groups learning, and every week you meet with 2 faculty members who are your advisors and actually do whiteboard talks. It's more of a case-based learning instead of sitting in a classroom with PowerPoint. It's more interactive, much more informal, a lot of fun, and it's a way for just relieving some of the stress. Once you start clinical rotations, you have core rotations that everyone will do, but not in the same place. Take emergency medicine. It could be at Grady with a level 1 trauma center, but it could be in Tifton, Georgia, which a smaller ER that's much more general focused. And so you let your preference be known of where, and this will be decided by the clinical team to try and get you to your preference. But everybody does these: emergency medicine, family medicine, inpatient, internal medicine, OBGYN, peds, psychiatry, our farm worker project, and surgery. So these are 4 weeks each. You rotate and work just like a job, working on a team with a preceptor, either one of the a faculty member there or a practicing physician or PA will be your preceptor. And you work with the hours set by that team and that specialty. Every 4 weeks, you come back to campus. There's an end of rotation exam for these core rotations. There will be some education, and then you're right back out to the next rotation. So usually that's just 1 day out of the 4 weeks that you come back to campus. The rotations that you have available for elective are many. There's several hundred that Emory has already has approval. So you get to pick and choose where you might want to do an elective in any of the specialties, including academic elective, where you might want to learn to be a faculty member in the future. But these are all set up for you and ready, so you don't have to go find these rotations. Many of these could be an opportunity to just scope out a place for a job. Again, there's fun times you can go to the GAPA meeting. We do give you days off to go to our national meeting, which is AAPA, and to GAPA, our state association, which is usually in Destin or Hilton Head. This time we brought back the volleyball championship as all the schools in Georgia compete either in a challenge ball or volleyball. And it's a way to get out with your classmates and again, blow off a little steam and have fun and at a beach. We have our farm worker project. It's in its 24th year. It's 2 weeks in June, and there's a fall weekend project. And it is a massive event where we take down, you can apply for 1 to 2 weeks. It's like a mission trip, only it's in Georgia. We put you up in a hotel, but we actually go serve the migrant farm workers in the farms where they're working, and usually at their sites where they're housed or field side, even packing sheds. We're totally mobile. We bring down tents and folding chairs, and we bring our own pharmacy and equipment, even lights to work by night, and set up free care. So it is a wonderful event. And like I said, it test all your skills, because again, you're limited to what you have available. There is no CT scanner, there's no x-ray. You have to use your diagnostic skills to the max. We have volunteer physicians who are there to precept you and guide you, and we have backup with emergency rooms and a farm worker clinic there that can do follow-up. We have a Good Samaritan clinic that is a once a month on a Saturday run by the first and second year PA students. It's for the working poor of Atlanta, and it serves that population with excellent care. You volunteer to be a part of that clinic, and we have volunteer physicians to be your preceptors. It is based in a underserved area of Atlanta, right near Georgia Tech in the metro area. Again, after 29 months, it's time to graduate. So again, celebration time and time to go out and land that excellent job. So what makes a strong candidate? Again, excellent clinical experience. Again, at the highest level would be athletic trainers, nurses, combat medics, EMTs, respiratory therapists, again, med techs, counselors, social workers, dietitians. The first level would be medical assistants, scribe, patient care assistants, and clinical research assistants. So again, we really value your clinical experience. It gives you time to talk to people and find out if this is the right career for you, and to see if you like patient care. Community service speaks loudly to us, so please document your hours and what did you do. We really value underserved populations and doing healthcare like mission work out of your comfort zone in an area, especially with another language. Leadership, so get involved in your school or any areas in your community, because we want to develop you as a leader, but we value your experience as leaders. Honors and publications and academic awards or community service awards, please document those as they add points also. And your personal statement, you should have one for CASPA that's very general, talking about your journey to be a PA. You know, how did you get to this decision, and why is it the right decision for you? Each PA program is going to ask for a supplemental why us. And so for the Emory supplemental, you want to be sure and follow the directions of why you're a good candidate for Emory and what about Emory attracted you. And did you do your homework by coming and visiting or attending this open house virtually? Those are the reasons we give high points, as if you've done your homework to investigate the school and not just read the website. So please don't copy and paste your CASPA narrative into the supplemental. That just does not work. We want to know, why are you picking us, and what do you value about coming to this school? And that's true with any other school. So make sure those are targeted, and you have to do them individually. Best decision ever, Emory PA. If you have any questions, please scan this QR code with your smartphone. It'll take you to a Google form, and we would be glad to answer any questions you post. So leave us your email and we'll monitor that. And if we didn't answer your question in this presentation, we'd be glad to look at that by email and get back to you. And with that, I will end this session.